Hi, I'm Stacey Dombrowski. Welcome to My Matters, a show where we can answer all your questions about mind, body, and soul. Tonight's show is about sports medicine on a whole other level. We will be revealing some of the top secrets to optimal and physical health outside the box of conventional medicine. Joining me tonight is world-renowned sports medicine physician, Dr. Anthony Galea, founder of the Institute of Sports Medicine in Toronto and doctor to some of the most famous and well-known athletes in the world, such as Tiger Woods, NFL players Santana Moss and Chris Sims, New York Yankees Alex Rodriguez, and in 2003, Dr. Galea became the team physician for the Toronto Argonauts. Call in with your questions to win a copy of Dr. Galea's book, The Real Secret to Optimal Health. Thank you so much for being a guest here tonight on My Matters. What a pleasure to have you.
Thanks for inviting me.
So what does it mean to be outside the box, to be unconventional, outside of the different realms of medicine? What is that exactly?
I remember one of my professors at Mac said, what's the definition of genius? Well, a genius knows what he knows in his head, but what he doesn't know in his head, he knows where to look for it. And that really kind of hit home with me because I thought, okay, I have a problem, an issue, say a bad tendon. How do I fix that tendon? What's the physiology of a normal tendon? What happened to that tendon? How did it go wrong? And can I help the body heal itself by going back to basic principles? And that was kind of my search and rescue mission. And I would search everywhere to try to fix or heal those injuries.
I love that theory of the basic principles because really everything needs a foundation.
Yes.
And that's sort of what you're speaking of is finding the foundation and building from there.
Yeah, you always go back to basic principles because basic principles are always true. So the physiology of a tendon, the anatomy of a knee, there's always some normal basics. And then you have to understand, well, what went wrong? How did this tendon go bad? What were the mechanics? What happened on a physiological level? And when you do those basics and understand those basics, then you can think out of the box.
So it's really getting into the root of the issue.
Yes,
not,
the cause,
right.
Not the symptom.
The cause, not the symptom.
Right.
So what do you think has happened today in today's medicine where it's gotten so out of control?
Well, I think what happened was that a lot of physicians are today, not all of them, but some of them are almost glorified salesmen for the pharmaceutical industry. So they're trained, you have this symptom, you take this drug. So it's really a reactive, knee-jerk reaction, whereas physicians have been around thousands of years. And they had a wide variety of skills. They were physicians, they were nutritionists, they were counselors, they were homeopaths, they were naturopaths. So they had a broad knowledge and a lot of different skills, but as later centuries occurred, they started to go finely down a road and they gave up all these other tools that they had in their pockets.
So would your approach be a more natural approach to healing?
Well, I don't know if you would call it natural, but I think it's more physiological.
Okay.
I think what I do is I try to understand the disease, the mechanism of the disease. And if I need a pharmaceutical, I'll use a pharmaceutical, but if I can heal it by another means, I'll use that as well.
Okay, that makes sense. So I'd like to go right into what your specialty is,
okay,
because I think it's important and I think it might take some time, and I'd really like to make sure that we discuss it,
sure,
which is PRP.
Right.
Right? So it's it stands for?
Platelet-rich plasma.
Perfect, thank you. So maybe you can explain a little bit about that, who would use it, what it is?
Sure, well, basically what I'm trying is to use more of you. So if you have a bad tendon, how does the body naturally heal that injury or heal that tendon? Well, usually there's 4 phases of healing. There's an injury, and then there's a barrier phase. The body tries to, say you cut yourself, it tries to stop the bleeding. Then there's an inflammation phase. There's a proliferation phase. Then there's a maturation phase. So these 4 stages of healing, and they're always the same. Now, sometimes in a great setting, the 4 stages occur, the tendon heals itself. But sometimes something goes wrong in one of the stages. So what I try to do is understand each of the stages. What are the reactions that occur normally in each of the stage? So by, say you have a torn tendon, I'll take your platelets and I'll inject them into the torn tendon. And the platelets will release growth factors. They're like little construction crew. They come in, some are plumbers, some are electricians, some are masons.
They all do different things.
They all do different things, but they have an order and a sequence and they work in teamwork. And they reconstruct that tendon naturally. So what I'm doing is trying to help the body help itself in the tendon that's injured.
Thing that does work, so
yes.
It's great. Now, with PRP, would you put HGH inside the PRP? And why would you do that if that's so?
Yeah, no, you don't want to do that.
Okay, because I'm reading all this stuff on the internet that like it's all over the internet.
Now, in the PRP and in the plasma, there's your natural level of HGH that's already there.
Okay.
The problem is, remember how I said there's growth factors? Well, there's several growth factors. One of them is HGH, which naturally occurs. The problem if you add outside HGH into the plasma or the platelets, you create too much of the HGH and you negate the effects of the other growth factors. So you should never add HGH to the plasma preparation.
Okay, so just for the viewers who don't know, HGH is human growth hormone.
Yes.
So when I'm seeing this all over the internet, why does it say, I don't know if you'd even know this, why would they be putting that it is a good thing to put HGH in this PRP?
Well, I think it's more media myth. Okay. No one really that I know puts HGH in the plasma. No, some people use HGH by themselves or by itself into, say, the knee. There's a doctor down in Miami who has the patent on injecting human growth hormone into arthritic knees.
Okay.
And that was his patent. And I think some people assume that the PRP is human growth hormone. Originally, it was banned by the World Anti-Doping Association, but then they found out, well, it's not performance enhancing.
So HGH into the knee, so before we even go there, what is HGH exactly, and why would somebody use it? So let's start with that.
Well, human growth hormone is a naturally occurring hormone. We make it. It's what makes us tall during, when you're a kid and you're going through puberty. HGH is very high, and it gives you that growth spurt. Now, there's only a few indications for the use of growth hormone. Children with short stature that are below the 3rd percentile, and adults who have adult onset growth hormone deficiency. But they have to have certain symptoms, just like you would say you're thyroid deficient, there's growth hormone deficient.
So how would somebody know that they are deficient in HGH, and why would they even have a need to go get tested for that?
There are certain symptoms that some adults will have: fatigue, difficulty with recovery, difficulty sleep. They're very similar to thyroid. So when you look at it, you can't just say, well, you're HGH deficient. You come in, I want
some of that.
Yeah, because I'm HGH
I want to look younger, so I want some HGH, because you hear that a lot. Like, what if I took that and I don't need it? Like, I want to know that too, but after you answer the other one.
It's one hormone of many hormones that could have a similar clinical presentation, but it's not that big. It's a very small percentage of the population that is HGH deficient in adulthood.
I see. So if I was to take HGH and I don't need it, what would happen?
Well, the problem is it's like you have a water that you tap from. If you are making enough HGH yourself and you take outside HGH, you're going to stop making your own. Then you're going to have a problem.
Then I'm going to have a big problem.
Then you're going to have a big problem. Because then you're going to be dependent on the outside HGH.
Which is not a good thing.
The other problem is if you take too much HGH, there's side effects associated with that.
That's great. Okay, thanks for sharing that. There has been controversy, so maybe you can explain a little bit about how that came about. Sure. Not necessarily what happened, but, you go ahead, actually.
I think the controversy occurred because some of my athletes that I was treating people were assuming they were doing performance enhancing, and when it blew up in the media, people were the media kind of created a script that, oh, I must be doping, and that's how all these athletes are getting so, they're healing by banned substances, and that was actually all disproved in the court, and the judge ruled that
Absolutely.
it was all about healing. Now, with regards to the HGH, I take HGH, and the reason I take it is not because of anti-aging purposes, but I had a couple concussions, head injuries growing up, my latest one in my early 30s, and I ended up getting growth hormone deficiency as an adult. So I was transported, I had it on me when I was going into the States, and it ended up being mislabeled, and I ended up pleading guilty to a charge of mislabeling medication. It was supposed to have the RX on the box, and it didn't. And that was the only charge.
It's unbelievable. Thank you for sharing that story. Like, truly thank you. But it's unbelievable how when we go through something, we're able to help other people go through it. Like, it really is, because through your own experiences, now you can help other people who go through those experiences.
Well, athletes can't take HGH because it's a banned substance.
Oh, okay.
And that was, I think, part of the controversy, because
okay.
they're saying, well, this guy is a sports medicine doc.
And he has it on him.
He takes GH, and he has a small percent of my practice who I treat adult onset growth hormone deficiency.
Right. So I think that's where I was going with that. Yeah. But then you also help other people with the PRP, and then it kind of gets intertwined.
Well, it's intertwined because in regenerative medicine,
right,
growth hormone is one of the significant hormones naturally that regenerates healing.
Right.
So you can't not talk about growth hormone. What's happened is growth hormone has been demonized as Satan's drug in the media. But it's a hormone, just like thyroid, just like cortisol, like anything else. It has a certain specific role and only limited indications. However, in the field of regeneration, if a patient has no growth hormone, he or she is not going to regenerate an injury or tissue. So this is the controversy, and that's where I think, because of my kind of disciplinary or multifaceted practice, regenerative medicine, sports medicine, that's where the people weren't sure what I was doing.